Thank you, Victor, for that very kind introduction. I'm very honoured. And thank you to the ADB for giving me this opportunity to talk about the bank's work around health and well-being. And of course, by the bank, I actually mean yourselves, you, the staff of the bank, and the well-being work that you do through the projects that you support. Over the next 20 minutes, I'm hoping to convince you a little bit more than perhaps you already might be about the key promoting health and well-being work that the bank does, both through the lending that you do and the other technical advice and assistance that you give, and how this is likely to continue throughout the 21st century. And I think it's one of the golden threads of the work that the ADB does, I think, health throughout the projects that you support and deliver. So I want to start with 2 statistics and tell 5 stories around health and well-being and the work of the bank. On average, how many years do you feel that people in Manila live for compared to the rest of the Asia-Pacific region? Is it 1 year less, 5 years less, or 10 years less? Well, the answer is not too bad, but it's not great either. It's 5 years. Compared to the wider Asia-Pacific region, people in Manila live for 5 years less. Their life expectancy is shorter. But that's not counting places like Japan, where life expectancy is 80 plus. So we've got a long way to go in the region to move people to the highest levels of life expectancy and healthy life expectancy. My second statistic is about air pollution. How much do you think the yearly health and social costs are of air pollution in Manila? Well, actually, you might be quite surprised. It's actually over 1.6 billion, and it's linked to 16,000 premature deaths and chronic diseases linked to air pollution. And that affects all of us that live in urban centres. And unfortunately for all of us who live in these urban centres around the world, we've got recent research saying that air pollution may also be linked to dementia. So the list of issues around air pollution keeps growing. But it's not just about air pollution. I think one of the things that I'm keen on, and that our team are importantly keen on, is to talk about how the bank and how, when we look at health, we need to look outside the health sector to what we call the environmental and social determinants of health. And by that, what I mean is it's around agriculture and food production, sustainable transport systems, water supply and sanitation, health and social care, as well as individual lifestyles. But it's also about creating urban and rural environments that we all want to live in, that support healthy lifestyles, that create connections with families and friends. So I'm going to start with my first story. Energy projects, I think we all know, have tremendous benefits. They provide us, both near and far, with affordable energy for lighting, heating and cooling. But they also provide us with the means to save time and hard labour. They allow us to get involved in other economic and social activities beyond the kind of basic necessities of life. But energy projects also throw up unexpected problems. And this is one project that I'm going to talk about in terms of looking at the problems. It's a hydropower project in a rural area where an existing community is resettled in an area carved out from primal forest. So you can see there, you've got the new community, the new homes that were delivered by the project, and just above that, where it says 2, that's a rubber plantation. And then above that is the original forest. Now this looks idyllic on the surface, but actually there were a lot of issues around this. Unfortunately, the project proponents hadn't realised that what they'd actually done is created the perfect ecology for their local malaria mosquitoes. Small, clean streams, shaded by trees, was the perfect ecology for the existing malaria mosquitoes living in the forest. So without intending to, the project had designed in malaria outbreaks through the way it structured its project and its resettlement action plan. Moving on to my second story, transport infrastructure. As part of integrated transport systems, you might imagine it as a circulatory system of a city. just like the blood system of our bodies. Sustainable transport systems enable us to walk and cycle. They provide us with public transport, ideally bus and rail, and they provide roads and highways for motor vehicles so we can move across them. And most often, and ideally, they provide equitable, fair access to markets, jobs, services, and other opportunities, including social connections. And of course, the more classic public health stuff, they also enable us to increase the levels of physical activity that we do. But transport infrastructure, again, can generate a range of externalities. And I'm just going to mention 4 of them that adversely affect health. I've already mentioned air pollution. The other 3 are noise, injury, and severance. And severance, I think, is an important one that we don't often recognize and isn't often easy to spot. It's when infrastructure like rail and roads cut through communities, and that's between communities as well as within communities, that cuts one part off from another. And I think that's so that while there is access along the route, along the railway or the road, you are cutting on either side, people are cut off unless there are connections built in. The good news is, as I hope to show you through the rest of the presentation, we can often anticipate many of these challenges and issues and either design them out or minimize the adverse impacts and the associated health costs. So I'm going to move on to my third story, and this is an agricultural one going back, but a different set of impacts and more what you might call social determinants, social impacts. We all know agricultural development is an important part of rural development. Yeah, agriculture is there, we need it, it's part of what rural communities live and work around. And so rural and agricultural development help to ensure food security, both for farmers and the villagers and communities themselves in the rural areas, as well as for cities. They also generate some more sustainable incomes through that development for rural families. And hopefully, the kind of at the top end, it's about farming resilience, supporting farmers to be more resilient, particularly to things like climate change. However, again, they can also go very wrong. And when they do, sometimes they have, difficult consequences. So in this particular story, there was an accelerated development program that involved dams and irrigation infrastructure. And again, existing rice farming communities were resettled. And as part of that resettlement with the new homes, they got small plots of land. But unfortunately, for a variety of reasons, mostly linked to the accelerated development program, but also to wider social issues, I'm sure, that farming wasn't viable compared to what they had previously. So many farmers couldn't sustain their families. And so they started selling their land. And most of the land went to urban elites. And of course, these farmers didn't move from that land. They just rented it off the people they sold it to. So they were almost in a worse situation than they were before the development. Worse, because of the lack of livelihood and selling the land, because that means a lot to rural communities often. It led to depression. And through that, over the long term, what happened was we got an increase in suicides. And unfortunately, even worse, that was facilitated by the fact that it was the pesticides that the accelerated development program brought into the community that made it easier for the farmers to commit suicide. And I think what aggravated this scenario was the fact that the local government, with good intentions, thought pig farming would also be a good opportunity for local communities here. Unfortunately, in this rural context, the pigs acted as an amplifier of Japanese encephalitis. So that actually, far from pig farming being a source of income, it actually became a source of disease and ill health, and actually made the situation, again, much worse. So I think of the 3 stories, I hope you're seeing that from the field of health impact assessment, we found that often, or sometimes, and maybe even occasionally, depending on where we are in the world, development projects can generate unintended side effects. And it's trying to map those side effects and trying to prevent them that I think is key. And often, if you use a health lens and health impact assessment and approaches around that, because there's environmental and social impact assessment, and we all work together to look at how we design out and deliver these projects to maximize health. I'm going to move on to waste development, which again is another key area, particularly in Southeast Asia. And this is a classic kind of public health issue. It's been there 200-300, probably actually since the dawn of time, since we got together beyond the kind of villages. And it's always had, waste management has always had public health at its heart. And you think the story would be quite simple. You know, we know it. We've been doing it for centuries, for millennia, probably in one way or another. But actually, more recently, over the last decade, it's actually become quite complex and multi-layered. So just going back to municipal waste, without municipal waste, we'd have infectious diseases and pests running rife through cities. Streets would become clogged with refuse, as they did in Middle Ages. Injuries and deaths from garbage where families live would be common. And the stink, of course, would be unbearable. However, the two key new issues around waste are electronic household and commercial waste and how to manage that. And the other is pharmaceutical products and the disposal of that, particularly around domestic consumer use of pills and medicines. So I'm not going to go into a detailed thing about all the range of side effects or adverse effects that can happen, but I'm just giving you a flavour. So electronic goods, often it's around organic chemicals and around PCBs is the classic one that people might, the other one is heavy metals. And the issue is not when the computer's there and built, it's about when they're scavenged, when they're recycled, and when they're treated. And often a lot of the stuff from other parts of the world end up in Southeast Asia to be manufactured, and often not in state-of-the-art recycling facilities. So there's a huge health issue emerging from the lack of good quality integrated waste management systems. And these kind of heavy metals and PCBs can lead to organ failure and cancers. I think the more interesting one, certainly for me as a public health person, is the whole thing around pharmaceuticals, because obviously drugs and medicines are positive. You know, we give them to treat illness, to prevent pain, so they're a good thing. But unfortunately, what we've realized over the last decade is actually flushing them down the toilet, dumping them in our waste, they leach out. They leach out into the soil, they leach out into the water, and they are entering the food and water, drinking water chains. So we are all absorbing, ingesting small amounts, a range of medications, because they're there and we can't control it. And one of the challenges of that is how to manage, obviously, the waste that we generate around pharmaceuticals, and the challenges around what term endocrine disruptors. And what they are, essentially, they're kind of hormones. And because they're hormones, they affect us. So when we ingest them, they actually have small-scale and large-scale effects. And the kind of three key ones I want to mention is reduced fertility. So at population level, all of us, male and female, our fertility is reducing. Our opportunities or chances of having children are declining, obviously at a very small level. But it's something from a population health point of view is concerning. The other aspect is actually children having a lower age of puberty, which again is that they're becoming adults at an earlier age than they did in the past, 50, 100 years ago. And again, that's something concerning about child development. And the last one, obviously the classic one, cancer is always in there, and it's in this one as well, that all these medications, obviously when you take them, when you not want them, they always have some side effects. So that's a big issue again, that I think the ADB can help play a role in influencing how governments around the region tackle waste management and the kind of systems they build. My last story is about urban infrastructure. It's kind of the most obvious because we live day to day. You know, every day you walk, you move around. You know, as you go from home to work, you see the things that are out there. And in all communities, all cities, whether it's high income or low and middle income, similar types of issues. People are homeless, people living in illegal settlements or unplanned informal settlements. But one of the key issues is that actually more and more of us are living in urban and peri-urban areas. There's more migration into cities. And I think for Asia in the 21st century, it still will continue to be informal and unplanned settlements and how we manage them, planned mixed-use developments, special economic and industrial zones, new cities and towns. Those are going to be the key components of what urban infrastructure is, apart from the things that I've already mentioned, water and sanitation, transportation systems and agriculture. These are the additional things, housing, and how the bank plays its role in developing, because building something in a city means it affects the things around it. Often people will migrate to a new road and build informal settlements around it, hoping for economic opportunities, or a new industry, again, hoping for new jobs. And the picture here is taken by a colleague of mine, part of the team, as we were landing, and we really liked it because it kind of captures the tensions. You know, you've got the illegal, informal settlements there near a waterway, probably no water and sanitation, probably using that river for cleaning, cooking, and other activities. But you've also got industrial. If you look, you've got industry there very close to housing. And of course, you've got the classic thing of roads within a very urban, dense settlement. And I think one of the challenges, certainly from a public health point of view, is how do you get so many people in such small spaces, and how do you manage those overcrowded urban living conditions? So, because we all want to live in clean, safe, healthy, and aesthetically pleasing environments. So designing and building in health and well-being into urban infrastructure and development and maximising the range of benefits has impacts on reducing communicable disease and non-communicable disease and mental illness and well-being. And I think well-being from a public health perspective is the 21st century. We're all going to move low, middle and high. We'll have well-being on the agenda. It won't be enough to talk about reducing malaria because malaria will be linked to well-being, and that's part of the kind of new work that we're likely to be doing. So what is the bank doing? Well, actually the bank is doing quite a bit, and recently the bank developed its operation plan for health. And I'm hoping my 2 statistics and 5 stories will help you to get involved in this plan and the work around it. And so what is this plan about? Well, actually this plan is about using the bank and the infrastructure development projects it does to maximise the health benefits that come out of it. I'll quote a little bit of what the plan says. It reflects the bank's scaling up of health-orientated investments from the current 1 to 2% to 3 to 5% of its total portfolio by 2020. And that's, I think, roughly 1 billion a year or up to 2020. And to leverage health across all sectors of the bank and work to maximise the benefits that the bank-supported developments produce, both health sector and non-health sector. And for us, as you can see that little diagram that you saw before, but now in blue, it's also about the environmental and social determinants alongside malaria, HIV, and other climate change related emerging diseases that may occur in Southeast Asia. And just kind of emphasizing that point, there's 3 kind of targets, leverage health impacts by optimizing health outcomes from infrastructure projects, support improvements in regional public goods of the health sector, and health for health, supporting developing member countries in achieving universal health coverage. And my last slide, as part of this new kind of health impact assessment advisory group, with support from yourselves and the bank staff across the region, we're hoping to play our part in helping the bank achieve its objective, particularly around optimizing health outcomes across all its infrastructure projects. Thank you.